All right, we'll go ahead and get started. Having an issue with getting one of our media members on, so sorry, starting a little late, but welcome and thank you all for being here for our COVID-19 vaccine media availability. Today on the docket will be just a quick update from me on some of the information on our COVID-19 Washoe and COVID-19 WashowVaccine.com websites, and then we'll push it to James English to give you a COVID-19 vaccine update from the operational level. We have personnel from Renown Health on to be available for Q&A, but they won't have an update per se, but everybody will be available on the Q&A after Jim's update. So I'm going to share my screen here and just go over a couple quick options just on some of the updates we've made to our website recently here. Sorry, add a couple more people here to the meeting. All right, so as you probably noticed, our COVID-19washoe.com site got a makeover of sorts. We wanted to bring that information that we had regarding the vaccine and just the general COVID-19 in a way that's easier to digest. It's a little nicer looking aesthetically. It still has all the same components that we have. A lot of we're getting questions, and quite frankly, you probably are too, from the senior community wanting to know when they can get vaccinated. As we've mentioned, 70 and older is currently eligible under the general population lane of the state's playbook. So we wanted to make sure people could understand to sign up if they're 65 and older for our waiting list. That's on that big purple banner on our COVID-19 Washoe page. Sorry, I let a couple more people into the meeting. And then on the COVID-19 WashowVaccine.com, we launched this a couple weeks ago, but I just wanted to give you a quick little tour just to make sure you guys had, if you had any questions about just kind of what we're doing, it's all here. We're working on ways to make it easier for people to understand, but the way that the state's information in terms of who's in the priority lane, who's basically eligible right now to get vaccinated, who's not. We tried to bring that up right away. That's the question we're getting a lot, is who's currently eligible. So there's a couple spots on the homepage where you can see who's eligible. Right now we're doing 2 lanes at once with our frontline essential workforce and our seniors over 70. There's a handy priority list that the states released that kind of gives people an understanding of where they would stack up and when they would receive that. That's on at the top of the page. Going back, we have some numbers just from Washoe County, but eventually we want to put more numbers in there from a Washoe County and as a whole perspective. So we're working to get that. The Am I Eligible is a survey that kind of takes people and asks them a bunch of questions and helps them understand where they would be at in terms of that priority level. You guys can fill it out if you want, but we've had over 12,000 submissions to this form. I think there's a lot of people that also go through it that might not complete the actual survey and click when finished. So we're thinking it's getting more than that 12,000 mark, but that's a good tool for people to learn. If you go to the priority lanes button, we have more information that's basically in a little easier digestible form than the state's playbook. We have all of the groups listed, and we're bolding the ones that we're currently working on. So you can go through all those in kind of accordion fashion and see. As far as we know, media would be under the frontline supply chain and logistics under communications infrastructure. So that's kind of where our most media would fall under. The other really important tool that we've been working on is the Essential Business Search. So this is a tool that we're still continuing to refine, but there's a lot of ways where somebody can type in where they work and kind of help get a better understanding of where they would be in that lane group list. So that's one tool that we want a lot of people to be aware of, just to kind of help them out as they gain, just familiarity with kind of what's going on with this vaccine. The biggest thing to remember is that anybody in the frontline essential workforce will contact the employers and work through them to distribute those vaccines. For the general public, especially seniors over 70, right now it's just 70 and older. But also on this page are different options where seniors can sign up. It can be kind of confusing, but we just want people to know that there are other options besides just Washoe County distributing vaccines to seniors, and we'll continue to update this list. This is a very similar list that's on the NV COVID Fighter website that's being done by Immunize Nevada on a statewide level. So that information will match to hopefully give people the information they need to know in order to get the vaccine eventually. Other than that, I just wanted to give a quick update, and if you saw a post on Twitter about it, the pod is operational, rain, shine, or snow. We have snow, removal equipment on site. We used it this morning. We have a truck that has a blade on it that can remove snow, and we also have a little razor that can get rid of some snow too. We want to make sure that people have safe place where they can come get the vaccine, and as of right now, the weather has not caused any delays or issues, but we just want to make sure people are safe, driving safe through the elements. But we have no plans to cancel any of our pod operations due to weather, knock on wood. But we will continue to operate this week, even though there's a couple storms coming, or at least one big storm coming through. With that, that's all I have. I'll pass it over to James English for a update from the COVID-19 vaccine operations brief.
Good morning, everyone. So what I wanted to do was update everyone on our pod and vaccine situation for the community, so everyone understands where we're going, where we are, and where we're heading to over the next couple of weeks. We have received word from the state to expect a static allocation of vaccine for the next 2 to 4 weeks, while the federal government sorts out where the vaccine is and what the availability is. So this week, Washoe County, the entire region, received 6,250 doses. Of those doses, 1,800 went to the private pharmacy partners that are providing vaccines at their pharmacies, and that is for the general population 70 and over right now. So you'll see that is taking place with Smiths right now. They've advertised. Furthermore, the remainder of the vaccine was 4,450 first doses. So that was split among just 5 of our 17 federal providers here in Washoe County. The bulk of that coming here to the health district and to Renown Regional Hospital. That is because we are trying to do the best job possible to equitably spread out the vaccine between the general population and the essential workforce. So we are doing our best to keep Renown operational, doing the 70 plus, and then in the future, the 65 plus populations, while we concentrate on the essential workforce. Right now, inside that lane in the essential workforce, we're at child care's educators and NCHI staff and faculty. The next 2 weeks, we will be concentrating on school district staff to try to complete them and the remaining child care staff. That's the emphasis for this region as the largest essential groups that need to be done at the top of this lane. With that, our vaccine availability has decreased. As many of you remember, the very first shipment was 3,655 doses, and that was just the medical community. So we have not seen a large uptick. This is actually a decrease in vaccine this week. What I can assure you is, and this is a question we get asked all the time, all the second doses for those who receive first shots are showing up. So the region received 975 second doses of Pfizer and 4,600 of Moderna this week. So everyone who got a first dose is assured to get that second dose as planned. And this week, you'll see we are ramping up our second dose calendar as we move forward into that, both with Moderna and Pfizer. But what you're going to see is, as you're seeing on the national level, we are not going to be operating nearly as much as we would like. And we will be shutting down and canceling some of our pods and maximizing the days we operate with much larger numbers. We intend to start doing between 12 and 1,800 a day on the days we operate. And we're going to move to some more evening and weekend operations in an attempt to get the remaining child care and school district staff done. With that, I think I'm done with my update. I will let you know the health district has worked out a plan to be able to report our doses going forward. It may not happen today, but by tomorrow, what our first doses are and what our second doses are, so it's much more clear. We hadn't started second doses, so we had been reporting out our on-hand vaccine doses as an aggregate because we weren't at second doses. As of this morning, just so everyone knows, we have for first dose vaccine in this building 720 of Moderna, and we have 600 of Pfizer. Then we just got our shipment this morning, actually by 7:30 this morning, and it was only for 1,950 vaccination or doses of Pfizer. So on second doses, we have 61 of Moderna, and we have 56 of Pfizer. So we are, as you can see, we are pushing out the vaccine as quickly as we can get it. And I know all our regional partners are doing the same. So we are continuing to work down that path. Furthermore, we are trying to support Community Health Alliance. They are great assistance to over 70 group, and North Lake Tahoe Fire Protection District is continuing to move forward with some closed pods in the incline area. With that, that's the end of my update.
All right. Thank you very much for that. We'll go ahead and open it up for Q&A for both James English and if you have any questions for Renown. So please go ahead.
This is Paul Nelson with 2 News. Governor Sisolak sent a letter to HHS frustrated about being second to last per capita with vaccines. Are you guys equally as frustrated by how much vaccine you guys are getting each week?
Jim, you want to take that one?
Sure, I will. Yes, we are. We had conversations with our U.S. Congressman last week. I am in constant communication with State Health. They are doing the best they can with the governor's office to understand the metrics and the demographics the federal government is using to determine vaccine allocations. They have not gotten a clear answer on that, and we continue to work with them to do the best we can to get all the vaccine we have. We are pretty frustrated because we have all the pieces in place and our regional partners do, and now we're at the point that we don't have the vaccine to distribute and put into arms.
Any other questions? And if you have them, please direct them to either the Health District or Renown.
Hey, this is Ben Marge. Oh, go ahead, Paul.
I was just going to say, for Renown, how are you guys keeping up the pace as these all come in? Are you guys getting your shipments from the state, or are you also getting those mostly from the Health District?
Good morning, this is Melody Osborne. I can go ahead and take that question. So currently we are getting all of our allocation from the County Health District, and so far we've been able to keep up pace. We just finished out last week giving a little over 3,100 vaccines to those in our community who are 70 years and older, and we continue to keep up with that pace.
This is Ben Marzot with News 4. Question for the Health District. You know, you guys are going to have to close down the pod on some days. Just how frustrating is that to put in all this effort to stand up these vaccination sites, and you can do, 1,000 a day if you had the vaccine, and there's just not enough shots available. How frustrating is that?
It's extremely frustrating. The only positive out of this is we can continue to plan and have all the pieces in place for when the vaccine's available. This will allow some of our staff to get a break. Many of the nurses, National Guard, and volunteers are out there. If they're not doing first doses, they're doing second doses, and we're still doing COVID testing at that location. So we're going to go ahead and operate as efficiently as we can. It just does not look as good to our community, and that's where we'd ask our media partners to help us explain it's a vaccine supply issue. It's not a inability to get shots in arms or schedule at this point in time.
So will you guys be scaling back to maybe like 3 days a week, or is it just depend on the week?
Currently, right now, we're probably going to still be operating 6 days a week because of second doses. This week, we were able to work with the state, and we got at least enough vaccine to provide for all the pods we had currently scheduled. But the week of Monday, the February 1st, we are only going to run 3 pods instead of our originally planned 5. So that is the change the region's going to notice, because we are going to go ahead and plan moving forward to only have about 2,400 doses available for the health district to either give themselves or give to the community partners outside a renowned regional medical center.
This is Paul Nelson again. With Dr. Fauci said that it could be a couple weeks and Johnson & Johnson could get cleared for their vaccine. If that happens, how big of a boost could that give you guys for increasing supply here?
Well, any additional vaccine would be a huge boost. We have not seen any official information on that. And if the Johnson & Johnson vaccine rolls out much like Pfizer and Moderna did, we will get all our provider information, how the shots are given, how they're stored, how the vaccine is handled, right about the exact same time they get their emergency use authorization. We're just now getting access to some of the research studies that show the efficacy, and some staff are looking at that. But any additional supply will be helpful. That will also be helpful statewide, as it is my understanding that's a strictly refrigerated vaccine. So there is no freezing, whether ultra cold or standard freezing. And therefore, it may allow that vaccine to go to other areas where transport's not an issue, so that we can then continue to gain access to Pfizer and Moderna to ramp up here at the health district. But right now, we'll take any vaccine we can get as long as it's approved. And I know our fire partners and our small federal PIN providers have all told me they would like to get their hands on Johnson & Johnson. We're also not sure if that's a 1-shot or a 2-shot. They are running multiple research studies right now and efficacy studies on that vaccine. So everyone's intending that to be a 1-shot, which makes logistics quite a bit easier. But until such time as they present to the FDA and the CDC, we won't know exactly what we're dealing with.
This is Siobhan with the RGJ. So this week you're doing K through 12, NSHE, and childcare, right? And then the other agencies you partner with, like the Renown and Community Health, are doing seniors. Is that correct? Do I understand that correctly?
That is correct. North Lake Tahoe Fire Protection District is also doing NSHE staff, childcare staff, and educators this week in Incline. They're trying to get some of those groups done before the snowstorm, but they also are intending to do a 70-plus pod this week, depending on weather.
So of the about 6,000 vaccines you got this week, how many will go to NSHE and childcare and K through 12?
All right, let me do that math really quick. 60% of this week's allotment is actually going to the general population to 70 and older. So only 40% of this allocation of 6,250 first doses is going to essential workers.
And you guys are going to do K through 12 yourselves, or will you allocate some of that to the school district? I know they've been trying to get up and running their own pods.
We're still working on the logistics with that. that we can do it either way. Currently, most of our providers outside of Renown, St. Mary's, and Northern Nevada Medical Center, everyone else has been using Moderna. The vaccine that we will be giving to essential workers this week and next week is all Pfizer. So we're in discussions right now on how best to plan to move forward. I do think that regionally it'll be much easier to operate that out of our location, but that should be formalized by the end of the week.
This is Stanton at Colo. Have you had any issues with people not showing up for their second dose? And what happens if someone doesn't get the second dose of their vaccine?
Actually, our second doses look to be getting a lot better. We only had about a 1% no-show rate yesterday. So that was the best we've seen. That kind of lines up with what Renown told us last week. But right now, we're concentrating on the second doses, and we believe people will show up. Those that have reached out to us, we are working. We have one person set aside that is just rescheduling second doses. Furthermore, we're working with the state and our rural partners when they have second dose people that need that shot. Pfizer is not widely available in the rurals, and that first shipment that was received statewide was all Pfizer. So we have medical providers out there in Winnemucca that may be coming in for 1 or 2 shots, and we have to work them into our system. I do not know the exact efficacy, but if you do not get the second shot, you're not nearly as protective as you would be if you got both, which is right there at that 94 to 95%.
Any other questions?
I've got one more. This is Paul Nelson again. So on the website, it says that you guys have received a total of 18,910 doses, and you've administered more than 16,000. Is that including this week's shipment? Because that leaves about 2,700 doses that haven't been used yet.
I'll defer to Scott on that.
No, I think that was as of our count yesterday. So that's about to go out in our update. So we'll update that again here pretty soon based on the shipment that we received this morning.
So everything's on schedule then?
Yes, it is. We're on schedule to go through all the vaccine we have. What the health district is holding back, more or less at my direction, is about 200 doses. And that is of Moderna in case there is something that goes wrong with another provider's shipment that we can quickly backfill so that their scheduled shots can move forward. So we've already seen that happen once in our region. So I have worked extremely closely with the state immunizations program, and we are holding back a small amount of Moderna for that exact scenario. So we, outside of Renown, our other regional partners that received vaccine all got 200 doses or less today, direct shipped. So if one of their shipments came in where it was questionable or they had to reach back out to Moderna for information regarding whether or not that can be utilized, we have seen that takes upwards of a week to get an answer. That said, we could quickly deploy or transfer 200 doses to them so that they could operate as they had planned and scheduled, instead of having them have to reach out to our citizens and cancel all their scheduled appointments.
James, this is Ben Marjat with News 4 again. You said you spoke with our congressman, I assume you mean Congressman Amodei, and maybe our senators. What did they say about, and what can they do about increasing the federal government's allocation?
They said they'd take the message forward. Amodei has actually been on site and looked at our operation, was extremely impressed. I think they fully realize that Washoe County is fully prepared to vaccinate and provide all the vaccine we can get our hands on based on the regional plans we have in place. So I think their messaging will be excellent, and whatever they can do to assist our region will be more than helpful.
All right, last call for questions.
Yeah, this is Jason Hidalgo from the Reno Gazette Journal. This isn't necessarily a vaccination question, so it might be for you, Scott. Like, do you know why there's been an increase last week in the number of new cases for like 80 and older populations, while every other age group went down significantly?
Yeah, Jason, I reached out to our epidemiology program manager, and I'm still waiting to hear back. But once I get that information, I will send that to you. And
Okay,
if anybody else wants it, just let me know. All right. Sounds like that is all the questions. So thank you all again for being here, and thanks to Renown. We will still have Kevin's Wednesday availability, Kevin Dick, District Health Officer, Wednesday at 11:30. And then we are moving forward with the Thursday vaccine briefing as well. And I'll try to give an update a little sooner before the meeting to let you know who will be on that call. The health district will probably not be on that call due to the state COVID-19 task force meeting, as well as our district board of health meeting. But I'll try and be on just to answer any other questions that might come up. But as always, the meeting was being recorded, so you can find it on the COVID19washoe.com website under daily updates. Hover over that, and then it's under press conferences. So if you have any other questions, please feel free to reach out. And thanks again to everyone for being here. Have a good week. Thank you.